All right, good afternoon, everybody.
Good afternoon.
So my name is Dustin White. I'm the Vice President of Healthcare at Paymentus, and I've got Danielle here with me today. I'll let you introduce yourself.
Thank you. Danielle Reese, Vice President of Patient Access and Pre-Services at Hackensack Meridian Health.
And I think we said we were going to do a fun fact, right? You want to go first?
Yes, I am going to go first. So, fun fact, I am a sommelier, first level though. That's a fun fact about me.
That is, and I'm very impressed about that too. So my fun fact is a little bit different. I have, I'm going to say famous names in my family. My mom is Betty White, and my father-in-law is Phil Collins. So again, famous names, not famous people.
And I can't top that.
Well, cool. We're going to go ahead and get started today. We're going to talk about 5 strategies for improving billing and payments for your patients and your staff. I think the digital transformation of healthcare, we've seen it in different cycles, right? Very reliant on paper historically. But as technology has gotten better, as we've moved in with EHRs and things like that, we're starting to see a big shift in the digital world, especially when it comes to payments as well. There was a study recently from McKinsey that said 75% of healthcare executives have the digital transformation as one of their top priorities. So we'll go ahead and get started here. It is critical from both a cost perspective as well as the experience for your staff and your patients. So we'll talk about the 5 different strategies today. First one's casting a wide net without adding cost. I think everybody's very cost conscious today, and probably more so today than they were 5 years ago. Improving the patient communication, improve the self-service capabilities, prioritize security optimization, and lastly, the transition to digital disbursements when it's related to patient credit balance refunds. So I'll go ahead and get us started here. Actually, I've got a question for you.
Okay.
So we're talking about casting a wide net. Mm-hmm. In your world, your personal preference, what ways do you like to pay your bills? Your paper check?
Oh, no, I want easy and efficient. If I have my Apple Pay or whether it's through Venmo or Cash App, I want to quickly get the payment completed.
I'm with you.
100%.
I'm an Apple Pay guy too. I like it.
I love Apple Pay.
It's just so easy.
And it's secure.
Yeah. So I think what we see out here, no 2 patients are the same. And kind of a quick comparison, my mom, Betty White, who I talked about a minute ago, she's in her 70s, and she's pretty technologically advanced, I would say. She can do pretty much everything that I can on a computer. But she's more of an online. So she wants to go in, she wants to sign in, she wants to see everything. But like you, I'm Apple Pay or even text to pay. Like if you text me and it says reply pay to make this payment, that's quick, that's easy, I'm done with it. So that's the big piece for me. But really, what we mean when we say cast a wide net is offering all of those different solutions because no one is the same. Online, IVR, text to pay, all of those different things are what we want to be able to have for the patients to make the payments. So.
Including even reminders. Sometimes we forget that we're supposed to make a payment, but then I get reminded. I'm like, oh, now I can go and click text to pay.
Yeah.
How easy.
Yeah, absolutely. And I think, again, it provides a better experience for the patient. But for you, it probably brings in that revenue faster, right?
Quicker, yes. We look at everything on the front end as far as, whenever there's pre-registration, we look at patients trying to get online to make a payment before they come in, before their service, and how quickly it would be so they can make those payment solutions much easier through a platform. I know some of us may be on Cerner or Epic, but if I'm in my chart and there's a little button that says pay now, and I get my electronic receipt delivered right to me, it's right there. There's no paper.
Yeah.
It's so much easier.
Yeah, not to mention the digital wallet too, right? So the payment's already there. You don't have to punch it in.
And even being able to store my information, if I wanted to store my credit card information, making sure that it's safeguarded, the information is protected so that I can have auto pay turned on as well.
Yeah. Oh, we love that one.
We love that one. It's my favorite.
Anything else on the casting a wide net here?
No, I think it's just important to, one, make sure that there are multiple solutions that are available for patients to make payments. That, no one wants to mail in the check and the check got lost in the mail. Making sure that patients have an easy and efficient way of making payments today, whether it's through Venmo, PayPal, just having those solutions available and quickly.
Yeah, absolutely, absolutely. So our second one here, and I know this is something that you feel very strongly about, patient communication. I think that if you don't know that you have a payment, you're not going to make the payment, right?
Correct.
So I think that it's really important to send these notifications, again, digitally. We're probably not ever going to get rid of paper statements. I wish. I think it would be great.
I don't think we're ever going to.
But I don't think we're ever going to completely get rid of them. But in conjunction with those paper statements, if you're sending those notifications, either text or email, you've got clear communication to your patients that they have a balance. And I think the other important part is they know how to pay it, right?
Exactly. And I think it's important to not only the statements, but the information has to be clear. What am I actually being billed for? Mm-hmm. Having that clear identification of how much am I being billed for? What are my exact charges? We get into this whole world where we have physician charges and hospital charges, but the patient doesn't see any of that. So making that very agnostic to the patient that it doesn't matter. These are the exact charges that I owe, and here's a quick and easy way to pay.
Yeah, and the stat that we have on there is 18.2% of patients call for clarification on the bill. And
absolutely.
I'm surprised it's not higher.
I would have bet that it would have been higher too.
I would have bet higher, for sure. So another thing too that we talked about here, along with communicating the balance and how to pay, also communicating the options for financial assistance, like a payment plan or something of that nature. Is that something you feel is important in the communication world too?
100%. And I think if we learned how to adapt to the digital world of that, we have physical financial counselors that are always present, but what if I wanted to meet with my financial counselor virtually? Do we have those options and solutions available, right? Maybe I can set up a time and date so I can connect with my financial counselor, and they're like, did you know that you could just click on this link to make your payment plan? That would be so much more efficient.
Yeah. I do think it's important for when you've got things like payment plans, and if it's self-service, you've got to have rules around it, right?
You do.
Yeah. You don't want a $1 payment for 100 months, right?
No. But you do have situations where patients do have an out-of-pocket, or they may have a balance of $500 or $1,000. And every patient is different. It's really difficult to determine which patient is going to apt to pay for a certain amount versus another. So you want to have those solutions that are available to help patients to make those extended payment plans when they need to.
Yeah, absolutely. And I think too, communicating those reminders when it is a payment plan, making sure that they may have set it up, or one of your financial counselors may have set it up, but a month goes by, they may have forgotten about that. So important to keep them up to date on how that plan's going and when they're about to make a payment.
Absolutely. And not only that, but those reminders are helpful. Like, oh, did you know that you have a payment coming up on the 6th? And you could tap down to make that payment now, so you could just forget about it. Yeah,
absolutely. And I know, what about for educational purposes?
So I'm a huge advocate of patient education, and I think that we can only do better by continuing to engage with our patients more and more and providing information of what's available, what's new, what's out there. So I think whether we do that through community centers, we do that through our healthcare organizations all the time, we're constantly trying to talk to our patients and let them know what are the new solutions that are available. And if we have the solution to where a patient can make a payment on time and they know about it, they're most likely apt to use it.
Yeah, absolutely. And then what do you think? Do you think patients are more open to text messages over email or vice versa?
I have seen text messaging. Yeah. I've seen that through self-registration. I've seen that through patients checking in. They have their phone right with them. The time that it takes for them to go to their email, scroll through, find the information, then communicate it back when their phone is right there. So you have the ability to communicate quicker through text messages. Yeah. But that's been my experience.
Yeah, I think I agree. And I'm just thinking of my own email. I mean, I get so much spam. So you're sifting through all this stuff and you may miss it.
It's the email traffic. Yes.
Yeah. So third here, increasing adoption of self-service payments. To me, this is kind of a two-way street. So I think there's definitely a part of this is the patient experience. You want to give them, kind of empower them to take the road or the path that they want to take when they're paying. But I also think there's a staff part to this as well. If you think about how many, we saw 18, a little more than 18% of calling in. We think that's a little low, but if we can give patients options for an automated IVR, or the text to pay, the chat bots, all that stuff that allows them to serve themselves, what does that do for the staff?
Well, I think that empowers the staff to do a lot of the other work instead of the tedious, redundant work and following up with the patient, whereas though now they can help probably provide more financial counseling services now. There's more re-education to staff too, to kind of give them the opportunity to engage with patients more now too. If they have additional questions that are outside of this area, they can engage more with our patients. So I think it's being able to have the patient have the self-service tool, but also another avenue to say, maybe there's other questions or other avenues we can help our patients through with financial counseling, with finding, whether it's through government programs that we can kind of work with our patients with as well.
Mm-hmm. Yeah, absolutely. So when you've made changes, either payments or any other kind of changes that are allowing the patients to self-serve in any area, what's your approach to take to kind of notify them and get the message out?
Oh, absolutely. So one of the ways we educate our front end teams a lot. We do a lot of re-education with them. And as patients are coming in, we're having those engagement discussions with them. Did you know that we have this new feature available? We could set you up on this right now if you have time. And so I think just that communication is helpful. Customer service, when you have the patient over the phone, having that communication, you can re-educate right there. We are in an Epic system, so we do a lot of education on my chart as well. So just having that message, did you know that we have these new features available? And having an outreach number in case there's questions, but being available.
Yeah. Yeah, and so just curious how you feel, like from a self-service perspective, do you feel like your patients are more likely to take those self-service options versus?
100%. We've turned on being able to make a payment through my chart, new features that we've turned on, and it's amazing how many patients have taken advantage of that. So I think the more that we can just continue to push information out to our patients and engage with them more and get them comfortable with the information, they're definitely going to take advantage of the solutions.
Yeah, and I know we've talked a little bit before about the trust.
Yes.
You want the patients to trust what you're putting in front of them.
Not only that, but we're dealing with a climate today where we have fraud, identity protection, in the same way how we safeguard our information. We need to ensure that we safeguard our patients' information. We do this with PHI. They need to know that when they're giving us their credit card information, that we're safeguarding their information as well.
Yeah, absolutely. And I think that's a good segue to our next one. You nailed that perfectly. So prioritize security optimization for your call center. So I don't think there's a hospital or health system out there that doesn't have a call center. If you don't, then you're not getting that 18% of calls. But I think it's a couple of things here. The medical billing process to a patient is very complex. It's very confusing. And then you pair that with just the cost of it. So you've got patients that are, oftentimes calling in, they have the questions, or they may need that financial assistance that we've been talking about. So, I do think it's very important to give the patients the ability when they do call to have those options, whether it's an automated IVR, or if they're having the conversation and they're ready to make a payment, making them feel comfortable in doing that and making sure that you're compliant while doing it, right? I've heard, I've been doing this for a while, but I've heard of people writing down credit cards on a piece of paper. I've heard that, typing it into a keyboard. I mean, I've heard it all. So that is definitely something that you want to make sure you're moving into a more compliant and digital way of doing it.
Absolutely. I mean, there's even features, I don't know if anyone's ever experienced this, where you're over the phone and someone is asking you to make a payment. They said, we're going to send you an automated text just to verify that it's you before we make the payment. Why can't we have something simplistic like that?
Yeah, yeah. I think we need to get it out there, right?
That's right. Absolutely.
So yeah, I think we deal with a lot of things in healthcare. We've got HIPAA compliance is obviously a big, I don't want to say a challenge, but it's an undertaking, right?
Yes.
And then in the payment world, when you add this in, we've got PCI compliance that you have to worry about too. So, what are some of the areas that you feel are important to make sure that you've got some extra coverage when it comes to payments?
I think definitely customer service. We look a lot around that. We have a lot of our front end staff making a lot of payments, definitely with their remote now. So we make sure that we have compliance and PCI hardware to make sure that information is protected at all times. And I think testing those hardware and running security checks frequently is important. But then I think it's also important to engage with our patients to let them know that we are protecting their information as well, so that they feel comfortable sharing information with us.
Yeah. Yeah, I think you bring up a very interesting point too about the remote workers. Yeah, that's a tough one because you don't know what they're doing, right?
That's right.
They're at home somewhere and they could be writing it down or they could be doing, I mean, there's a million different things that could happen there. So that is an interesting challenge that needs to be solved, huh?
Yeah, and I think that it's important to have, internal resources also to do a lot of your QA work, a lot of the QA checks to make sure that information is being secure and protected at all times as well.
Yeah. So our fifth play here, transition to the digital patient balance refund. And this one wasn't in your world as much, but I think in today's world, everybody is moving more towards a digital solution for everything that we do, not just the refunds, but having the ability to provide the patient with a quick and easy experience to get those refunds when they do happen is important because we're getting rid of cost of the checks that are being mailed out. And I was talking to a group, they're sending 10,000 paper checks a month.
And how much of that is actually reaching the patient?
Right, and how much of it is $5?
Right.
It's costing more to send that check than you're actually refunding the patient. So, I think this is an area where we haven't seen a lot of improvement in the past, but it's a huge problem.
Well, transparency, we don't like credit balances, okay? So we don't want those. But if I think from speaking about the patient, if there was a refund, I would want that to be deposited quickly and efficiently as possible.
Yeah, yeah. Instead of waiting
for the check in the mail, that might get lost.
Checks in the mail. I think it's a very important thing to offer to your patients, and I think again, meet them where they are, give them what they want, how they want to receive it. If they want to receive it to their Venmo account, then that's where we should be sending it, or PayPal or their debit card, whatever it may be. But we should give them that option.
But I think that that's really important because we keep talking about how they can have efficient ways to pay and efficient ways to get refunds. But again, I think the patient should make that choice. Mm-hmm. When you give the patient just one option or two options, but if you give them multiple options, maybe they may want a check. Yeah. Perhaps, but at least they'll have that option.
Yeah, yeah, and I think that's one of the things that if you can make that process simple and you can get rid of the checks, then you're also probably going to decrease the escheatment process.
Sure.
Because again, if you get that $2 check, it's probably not the biggest priority. No. But at the end of the day, that $2 is going to have to get issued to the state, and that's not a fun process.
Exactly. No, I agree.
All right. Well, that is what we had for you. We're happy to take questions, but really appreciate everybody coming today, and hope you enjoy the conference.
Any questions for us?
All right, I guess we nailed it.
All right.
Thanks, everybody.
Thank you.